Hey there, caregivers, and welcome back to the next video in our dementia behavior series. We're going to talk about sundowners and what that looks like and things that you can do to help mitigate those behaviors from happening in your home. Sundowning is a common and challenging symptom of Alzheimer's and dementia. As the day starts to fade into the afternoon and evening, individuals may experience heightened anxiety, confusion, restlessness, or even aggression. Some people may become delusional or paranoid or feel an overwhelming urge to wander or pace about your house. Others may struggle with disruptive sleep patterns or nighttime restlessness. These symptoms can be distressing for both of you. It can often cause unpredictable and challenging situations. However, with the right strategies, you can create a calmer and more predictable environment. Sundowners isn't fully understood, and research shows that about 20% of people living with dementia will experience sundowning symptoms. And while it's not possible to completely eliminate sundowning completely, there are effective strategies that I've taught families in my practice that have helped them manage some of the symptoms. Now, previously in our other videos, I spoke about the dementia ground rules that I live by, and I want to briefly remind you of those now. Number one, we cannot change our person. So instead of trying to change them, try to accommodate the behavior and not control the behavior. The second ground rule is to check with the doctor for other causes. If you notice a brand new change in your person, going and checking with the doctor just to rule out organic causes is always your best bet. Third, all behavior has a purpose. Try to think about what unmet need your person has and meet the need before the behavior starts. The fourth ground rule is most behaviors are triggered. Try to find out what that trigger is and disrupt the trigger before that behavior happens. And lastly, and most importantly, a thing to remember is that there's no one size fits all when it comes to dementia care. So, what works for one person may not work for your person, and what worked earlier in the day might not even work right now. So, just remember to always log those behaviors. But now that we know what sundowning is, what are some of the things that we can do to reduce or manage sundowning symptoms? So the first thing that I think that you should do is step into their reality. People with dementia may mentally return back to a time in their life, perhaps when they were raising their children or waiting for their parents or preparing for work. So instead of correcting or contradicting them, gently step into their reality. If they believe that they're waiting for their children to come home from school, why don't you try engaging them in an activity that they would have done previously? Maybe it would be making a snack or putting out notebooks or pens and pencils so that the kids can do their schoolwork. If they're waiting for their mother to come home, why don't you try saying something like, "She called and she's running a little bit late. So why don't we have a snack while we wait for her?" Redirect their focus gently and empathetically. And by providing the validation and engaging them in meaningful activities, you can often see their anxiety decrease. And you may notice that their body and their shoulders start to come down. And this will help with those smoother transitions so that maybe you won't see some of those sundowning symptoms. Second, listen for the emotion behind their words. During sundowning episodes, your loved one might say things that don't make logical sense to you, like asking to go home or searching for someone long gone. Instead of focusing on their literal meaning of their words, listen for the emotions that they're trying to express. Are they feeling lonely, afraid, or frustrated? Instead, try responding with empathy, saying something like, "I understand, that must feel hard. Of course, you miss your mom. I understand, and I'm here with you, and we'll figure this out together." Sometimes simple validation and reassurance can make a huge difference in your person and put their heart at ease. Offer comfort and support. Processing emotions can take time, and it's important to show your loved one that you're on their side. So you can do things like stay close by them, but without overwhelming them. So you don't have to talk to them just because you're sitting next to them. You can just sit next to them and sit in silence, but at least they know you're there. Your presence can be incredibly reassuring and help them work through their emotions at their own pace. Fourth, create safe spaces. I've talked about this one a lot. I think that every person with dementia needs a safe space, a space that they recognize that has those things that bring them comfort, whether it's a blanket, a book that they like to read, or a picture book that they like to look at, a fidget blanket that they can play with. If you haven't already set up a comfort corner, I suggest that you get one of those in place. Then that way, when your person starts to feel anxious or they want to pace around the house, you can take them to this safe space that's clutter free. Even if they want to move about freely, they can. You can designate them like a little walking area where they can go, and that can be soothing to them. And it may help them release that built up tension and agitation. Another thing that you can do is engage them in calming activities. By redirecting their energy into calming, purposeful activities can help them ease their agitation. So try simple and enjoyable activities, something that might be repetitive. If your person can be tasked, try giving them some laundry to fold, then unfold it and put it back in the basket and have them fold it again. Sometimes people like to listen to soft, soothing music or cuddling a stuffed animal or a baby doll. Simple coloring books or painting might help them, ease their tension. You're going to have to experiment with your person because what works for one may not work for all. Number 6, establish those routines. Establish a relaxing bedtime routine. Transitioning directly from daily activities to bedtime can be difficult for most people, but especially for people with dementia. So a structured, calming bedtime routine can make this transition smoother. And then just make sure you're creating that soothing environment. Lower the lights without creating those shadows. Play some soft, calming music. Maybe even try using some aromatherapy with scents like lavender, because that's not harsh. Avoid those overstimulating activities like loud noises or exciting TV shows. Try not to have any murder mysteries on. Engage with your person in quiet, peaceful activities like looking through photo albums or maybe even reading to them. If you're not much of a reader or you don't have that kind of time, maybe turning on Audible or rented from the library where they can listen to those books. Number 7, make sure that you're addressing their basic needs proactively. Like I said, most, if not all, behaviors have a trigger, and most, if not all, behaviors come from unmet needs. So if your person is experiencing sundowning symptoms, just make sure that all their needs are met. Your loved one may be hungry or thirsty. They may be overtired or physically uncomfortable. Maybe they're even bored or overstimulated. Make sure that you're looking at all of these things. Make sure that they're also dressed in appropriate clothing for the weather. Being too hot or too cold can also cause them agitation. By addressing these needs proactively a few hours before the sundowning symptom starts, usually can help mitigate some of those. Make sure you're scheduling their snacks, their bathroom breaks, making sure that if the doctors prescribe pain medication or medication for arthritis, that they're taking that in a timely manner, just ensuring that they're physically comfortable and providing that general reassurance. That way you can help them avoid the struggle that they may have when they're trying to articulate those needs. Number 8, make sure you're monitoring your own stress level. Caregiving is deeply demanding, and your own emotions can impact your loved one's state of mind. People with dementia are so sensitive to body language and tone of voice. So if you need to take a short break and go get a breath, or if you need to take a short break and just regroup, go do it. Because the more calm you are and the more patient you can be with your person, the calmer their demeanor is going to be back with you. Number 9, if you have to, explore medications as necessary. In some cases, non-drug strategies might not work. And if non-drug strategies don't work, you might need to consult with your healthcare professional to discuss what medications might work for your person. But as always, proceed with caution because some of those medications can disrupt sleep patterns or increase agitation. Some can even cause your person to get overly drowsy. And if they're a wanderer or a pacer, you don't want to put them at a fall risk. So you just want to make sure that you're documenting those symptoms. And if you have not done so already, go grab your free dementia symptoms tracking log. I'll drop the link in the description. Some final thoughts here. By stepping into your person's reality and listening with compassion and creating a calm and predictable environment, you can make evenings more peaceful for both your loved one and yourself. And while not every day will be perfect, try using one or more of these approaches to bring comfort and relief one evening at a time. Take care, and we'll see you soon.